What if a kid who's just not paying attention is wired differently and nobody sees it? Children with autism and ADHD, other known as AuDHD, it's crucial in being able to get them identified and diagnosed. The younger, the better. Because as life goes on, when they're in elementary school, middle school, high school, if this goes undiagnosed, other things can start to develop over time, like anxiety, depression, severe bullying. And I've seen cases of even trauma, PTSD. Hi, my name is Dr. James Thatcher. I'm a clinical psychologist, and I specialize in working with folks with neurodevelopmental disorders. And I've been seeing a very concerning pattern that's been happening to where there's lots of teens, young adults, and folks that go all the way up into their adulthood to where if these issues had been identified much earlier, they could have gotten the help that they need. And this is crucial, especially in school-age children, to identify ADHD and autism sooner rather than later so they can get the help that they need and they don't have to develop anxiety, depression, these issues that I talked about before. So today I'm going to talk about some red flags to look out for as an educator. But I also want to note that if you're a parent or if you're just interested in this topic, please stick around to the end of the video. And my hope is that no matter if you're a teacher or a parent or whomever, that this will still give you some very valuable information in being able to identify the specific traits in children with AuDHD. When autism and ADHD coexist with one another, it can be confusing for educators and parents alike to have contradictory behaviors that don't really quite seem to go together. So you may end up seeing a child that can hyper-focus on a certain topic or activity, but then seem completely disinterested in a range of other things. Another one may be that they have remarkable verbal abilities, yet they struggle with very basic organizational tasks. And what makes identification of these coexisting issues, ADHD and autism, even more difficult is that they may mask one another. So the social withdrawal associated with autism can be misattributed as inattention, or the hyperactivity that sometimes comes along with ADHD may overshadow some other aspects going on, such as rigid thinking or sensory sensitivities. I want to go over some key indicators that you may find children presenting in the classroom. As an educator, you have a unique position to where you get to see children in a structured setting. You have 15, 20, sometimes 30 kids in your class or more. And when one of them is behaving a little bit differently, that can stand out to you. So let me give you some clues and some signs that you can look out for so you can explore a little bit more to see if AuDHD may be present. One such area is inconsistent performance. What you may find is that kids with AuDHD perform extremely well at certain topics or in certain activities, but in other areas that require executive functioning skills, not so much. Their abilities plummet. And this can be particularly confusing, especially for educators unfamiliar with neurodiverse profiles. Another area to look out for is sensory sensitivities. These are going to be instances where kids get overwhelmed in particular settings. So watch out for the kids where they get overwhelmed during transitions or in the lunchroom where there's a lot of other kids talking, or in physical activity like in PE or during recess. And these are kids that may cover their ears when there's too much of a loud noise. They may retreat to quiet corners, or they may become irritable when sensory issues just become overwhelming for them. I've had a number of patients come in to where, and these are usually high school age, junior high school age patients that talk about how the fire alarm drills aren't just a regular occurrence for them. This is something that they dread and that is extremely painful for them. So they want to know ahead of time. So if there's a surprise drill, this can actually be traumatic for them to where they may refuse to come back in the classroom. They may leave the building. I've had kids talk about that before. It becomes absolutely painful for them. And I want to emphasize this point to where this is not an overreaction on their part. Their brain is wired differently. Again, this can be very painful for them to experience. So, of course, they don't want to come back to class. They want to leave the school. It makes sense. Another aspect that you may see is their social dynamics. So, kids with ADHD and autism may very well want lots of social connection. They want to connect with other kids. But with their attentional difficulties, trouble picking up on social cues, difficulties with reciprocal conversations, so back and forth conversations, even at a developmental appropriate age or level, it's hard for them to initiate, make, and keep friends. They might interrupt other people frequently, or again, they're not picking up on social cues. And they usually don't do very well during group activities. Another area to keep an eye on is the reciprocal conversation abilities, like I talked about before. So these are going to be kids that have a lot of trouble in being able to engage in a back and forth conversation, not just with you, but with other kids their age, especially other kids their age, to where you'll see them not really ask a whole lot of questions from other people, not comment on things after other people talk to them, not engaging in that back and forth. Rather, these may be the kids that tend to talk at rather than with the other person. Or you may see them bringing up their interest and just talking about that for a very long time and not picking up on the social cues that the other kids became disinterested a long time ago. Looking past the behavior to the causes is essential. What may come out as defiance or laziness may in fact be executive functioning difficulties. When a student consistently fails to follow multi-step directions, this may not be oppositional behavior. Rather, it could be a working memory issue that's common in both conditions. Another one is emotional dysregulation. Seemingly out of proportion emotional responses, kids blowing up, having a meltdown, may not be due to poor parenting or bad character on the child's part, but it's a neurological issue. Maybe they're having a meltdown from something that happened in their environment, or an overload of emotions, or stress had been building up throughout the day, and they have a meltdown. I can't stress enough that early identification of these children is essential. When kids get the support that they need, when people can see them for who they are and meet them where they're at, not only can we support them, but we can encourage their strengths, because there are lots of strengths that come from having ADHD and autism. Hyperfocus is a deep immersement into a specific topic that goes above and beyond what a neurotypical person could do. Another aspect that I see is I do a lot of cognitive testing on adults and kids, both with autism and ADHD. And what I see some of the time is unbelievable visual, spatial, nonverbal cognitive abilities that go above and beyond what I normally see. These kids have enormous strengths in being able to problem solve issues that would take a neurotypical person a very long time, if ever, to see, when sometimes they can see it like that. And without intervention, These kids can often internalize a lot of these issues. There's something wrong with me. I'm a bad person. Why can't I just make friends? And you can see where this leads. It leads to anxiety and depression, severe bullying, or trauma, all the issues that I talked about before. The right interventions don't just improve academic abilities at school. Rather, it can change how the child views themselves and how they interact with the world. So if you believe that a child might be on the autism spectrum or have ADHD, please bring it up. Talk to their parent about it. Help them identify this issue. Because the earlier that we can identify these issues, the better the outcome. If you suspect that a student or your child has ADHD or autism, seek out an evaluation. And remember, this could be the first step in them getting the support that they need.